Thank you, Eileen, for being on, and Peter and Christine. Hi, everybody. And Instagram, we're trying this for the first time. This is our Moms Connect call on Monday nights where we go over news, we connect, we share information. If you have something that you want to share, I want to hear about it. And we get updates. Hi, everybody on Instagram. And our mission is to educate and empower mothers and others with actions and solutions to create healthy communities. And our Monday night Moms Connect call, we're on Zoom, but I'm trying this little extra thing where we're going live on Instagram as well tonight to invite you to be on our Zoom calls and to be able to ask questions with us, right on Zoom, and to see our screen. I'm going to be screen sharing some important news that's happened. There's been a lot going on this week, folks, and I want to get into it with you and talk to you about the things that most impact us, moms, parents, people who care about our health. We've got topics this week on health freedom, on vaccines, of course, organic fraud, and glyphosate as an endocrine disruptor, and some other health freedom issues. So we're going to be talking about those. And if you want to be on our Zoom calls and see the screens and all that, then make sure to sign up, Instagram folks, with our newsletter and be on our calls each week. So, and we do have questions going on. I'm gonna get to the questions in just a minute. You can go to momsacrossamerica.org to sign up and to be on our Zoom calls. Hi, Susie. Thanks for having you here. I appreciate it. Okay, so tonight, some of the first news. Anne, while I'm talking about this first topic, can you queue up the article, the brand new article about the organic fraud to show? Because I don't know if I've published it yet. You can publish it if you want, and you guys will be the first ones to see it. We have some big news. How long is the Moms Connect call roughly? It's usually about an hour. And I know that sounds like a lot, but we have a lot of topics to cover, don't we, folks? Every week.
We usually go over.
Yeah. Oh, yeah. Sorry. We usually go over, to be honest. So yeah, go to momsacrossamerica.org and get the newsletter. I think that Esther is also going to put the link as well in Instagram so that you can join on if you want and be able to ask questions. Okay, so, and our Facebook Live did not work. I'm not doing Facebook Live tonight because it didn't work. It wanted me to live stream something instead of just using the screen. So sorry, Facebook is not getting this, but we do post most of the Moms Connect calls on our website under action or maybe it's events. Yeah, I think it's events and then Moms Connect calls. So you can watch them the next day if you want to, if you don't catch it on Facebook Live. Yes, it'll be saved on our momsacrossamerica.org website under events and Moms Connect. Okay, so we have to get into it, folks, because there's some important news that we need to share. And the first one is in the area of health freedom. And if you do go on social media, you probably already know that Dr. Paul Thomas from the state of Washington, he's a doctor. His license has been suspended. And we are extremely distressed about this. Dr. Paul Thomas is an amazing pediatrician. He is a doctor who recently wrote a book all about how to end the autism epidemic. And he faces attacks now on 3 fronts. The Providence Health Plans, the largest local insurance company, terminated all contracts. That means if you want to be his patient, you no longer get insurance. And number 2, the state of Oregon terminated all contracts. And I'm sorry, did I say he was from Washington? Maybe he's from Oregon. I didn't get that. Yeah, Oregon. Okay. And then number 3, breaking news. The same week that his data was published, Children's Health Defender posted this: by order of the Oregon Medical Board, the license of Paul Norman Thomas, MD, to practice medicine is hereby suspended effective December 3rd. As of this date and time, licensee must stop practicing medicine until further order of the board. Now, why would this happen, folks? Well, it's because Dr. Paul Thomas has been very vocal about the fact that his patients who receive sometimes less vaccines, sometimes they space out the vaccines, They have been, I'm gonna show you a graphic. So I'm gonna screen share and get back to here. They do not get autism as frequently. So this is something that has been, oh, sorry. Okay. This is something that's been very controversial. So many people say, oh, vaccines do not cause autism. However, he has simply accumulated the data on the numbers of children who get autism compared with the CDC. Sorry, I'm looking around here, so I'm getting distracted. With the CDC numbers, the people who follow the CDC schedule, the children, which is 69 doses by age 18, 1 out of 45 of them get autism or on the autism spectrum. The children who go by his schedule, the vaccine-friendly plan, which is predominantly, and pipe in here if anybody else has anything else to say about this, if you've studied his schedule even more than I have, but I believe it's after 3 years old. He delays most vaccines until after they're 3 years old, which makes a lot of sense because most of these vaccines are not tested on children or subjects until they're 2. Some of them not really tested very much at all. But he waits until over the age of 3 years old, or suggests, he doesn't wait, he suggests, and will wait until then. And then 1 out of 438 of those children end up on the autism spectrum. However, the children who do not get vaccines at all, according to his information, 1 out of 715 of those children end up on the autism spectrum. So these numbers are extremely telling, and really, you have to stop and think. You have to say, wait a second, what are we doing by giving our children 69 doses of vaccines by age 18 when the correlation of autism is so high in comparison, to the children that follow that vaccine schedule. So he put out some very important information, and I urge you to check out his book. He's got a bunch of books, The Vaccine Friendly Plan and How to End the Autism Epidemic, that came out just last year. And also check out, I'm going to screen share again, this page with the URL. It's paulthomasmd.com, freedom to choose. And that is there's a fundraiser there. We don't usually talk about raising money for other organizations, and we don't do it for individuals that, I'm so sorry, like kids that have cancer and things like that. There's just too many, we'd get inundated. But Dr. Paul Thomas has been on the forefront of raising awareness about what's going on with the vaccine schedule. And I really feel like it warrants raising, your awareness. So please, Dr. Paul Thomas is the name of the doctor. Yeah. And so you can check out his fundraiser for his legal fees at ftc.dpa or dpapproved.com, ftc.dpapproved.com, and paulthomasmd.com. So please check him out, and his books. Okay, and you can also see, okay, this is the next subject. Okay, I thought we had an article here from Children's Health Defense about him, but you can see the article about on Children's Health Defense about him on the Defender. And we're very grateful to the people at Children's Health Defense for all the work they're doing on getting articles out to raise awareness about many different issues. Yes, this video will be on our website. Thanks. On Instagram. And this issue is about 5G. But before we get to that, I just want to ask the people who are on Zoom, does anybody have anything to contribute about this issue with Dr. Paul Thomas? I know some of you have been a part of the health freedom movement for a long time. Anything you want to say about this? I want to make sure that I'm not the only one. Susie, no? And okay.
I think Mika's going to say something because she was connecting to audio, but maybe not. I hope a lot of people support him, and
Yeah.
I don't know how to stop it, except for all the doctors to band together, but a lot of them aren't going to.
Right. Yeah, a lot of doctors are not going to speak up. They're afraid of having their license removed and not being able to practice medicine. Andy Wakefield knows what this feels like. This is what happened to him from the UK. They took away his license, and he hasn't been able to practice as a gastroenterologist. And it's extremely, extremely disappointing. So, yeah, anybody else have anything you want to say about this?
I just want to say that I think that this is going to inspire Paul to fight even harder. He said he's going to come out with regular video content and everything now because he's not going to let this slow him down. So definitely appreciate you sharing the support stuff. We need to support him and get this out as far and wide as possible. Because yeah, once again, it's a witch hunt and they're trying to discredit him so that they can discredit that vax versus unvax study.
Right. Thank you, Susie. Yeah, thank you for adding in here. Yeah, he's not going to back down lightly, right? He's not going away.
Yeah, Eileen said, that they're getting death threats too, and we've seen that as well.
Yeah. Yeah. Well, and that's not going to deter people, because the people that are in this movement, and many of you watching right now, have already experienced vaccine damage. You may have lost a loved one already from vaccine damage. And once you face that fear or you deal with that struggle on a daily basis, it's so heart-wrenching and so difficult and irreversible. So you cannot, you are compelled. There's like really nothing else that you can do but try to warn other people about this. And that's what this is about. It's really about, the people who are part of this movement are just compelled to let people know, like, hey, I don't want this to happen to you. I don't want you to see your elderly father like I did, or your child go into convulsions or lose their balance or lose their, for some people, not my child, but lose their ability to speak or to go to the bathroom by themselves. I mean, what some people are dealing with is just unthinkable, and it's due to vaccine damage. And I know this video, may get taken down because of what I'm saying. But this is the risk that all of us take. We have to speak out in order to prevent this from happening to other people.
Getting your video taken down is almost a badge of honor. Unfortunately, other people can't see it. But I have to say, my daughter, when I first started working with Moms Across America, and we were going to Monsanto, my daughter was asked if I was worried about my own safety, and I said not really, and because I'm not going to stop doing this. So if something does happen to me, you'll have some good stories to tell. I'm like, I don't know what to tell you, but I'm.
This has got to happen.
Are going to always do it.
Yeah, we're going to always do it. That's right. So, thank you so much, Lady Carla Davis, who has the Masters of Health magazine, who's also going to cover this issue. Yes, censorship is increasing, especially in Australia. It's very difficult there to speak out about this issue, but that's not going to stop us. Like Del Bigtree and the Highwire said, they're just going to pop up in some other video venue, video stream. They may not be able to be on Facebook, but they're going to be somewhere else. The same thing with all of us. We'll just, pop up somewhere else, just like the chemical companies do with chemicals. You get one down and another one comes up like whack-a-mole. Well, activists can do the same thing. So, here we are. We're going to be up and going, and we're going to keep talking about it. All right, so the health freedom issue, there's one other thing that I wanted to mention about the health freedom issue is Qantas. So Qantas has come out and said that when the COVID vaccine comes out, that you will not be able to fly on their airplanes, especially internationally. This is internationally, without getting the vaccine. And I heard from some other video online place that they had backtracked about that they thought, oh, wait a second, what if this vaccine isn't effective? What if there's problems with it? Maybe we don't want to put all our eggs in one basket, and the profitability of our company, because so many people spoke out. They said they were going to boycott Qantas. And so maybe they're going to backtrack. So I called them today, and the person that answered the phone, which is, the reservation agency people, they said no, that is the case. They hadn't backtracked, and that if you want to fly on Qantas internationally, when they do open up flights, there's no flights now happening inside of Australia. Australia has completely shut down, or Qantas anyway, has completely shut down. There's no flights internationally. But when they do open up, that you will be required to get the vaccine. And I said, well, what if you've already had COVID and you're basically immune to it? Do you still have to get the vaccine? He said, I don't have an answer for you about that. And so the other question I asked was, well, what if you get the vaccine to fly, specifically to fly on your airline, and then you get vaccine damaged? Is Qantas going to be willing to pay for the damage that occurs to a human being from getting the COVID vaccine? And of course, the person who answered the phone, the reservation agent, didn't have answers to that. So he gave me the number for the headquarters, and I'm going to call or email as well and ask more questions. And I'd urge you to do that as well, especially if you are an American that wants to go to Australia. I think it makes sense to ask questions. Are they prepared? If somebody gets a vaccine and then they get on a flight and they go into seizures for vaccine damage, what are they going to do? What are they going to do about that? That's an important question to ask. So, if you want to make calls or emails, those are kinds of things that you can do. All right. So next issue, there's somebody that needs to be muted. Sorry. I hate muting people, but when there's background noise. Thank you very much. I appreciate it. All right. So the next topic, this one, it just never ceases to amaze me how science can get warped and used in a way that a corporation wants to use it. And in this case, this is about telecom industries using the science in a way to allow them to show that cell phones are safe. And what they do in this article in the Defender, this is a global campaign reveals why smartphone users have become test dummies for big telecom. So there's a new sort of an initiative or campaign out called We Are Not SAM. We Are Not SAM campaign is calling on mobile phone users to demand better safety tests and help expose the dummy in the room by boycotting 5G phones and signing this petition. Now there's new 5G phones, right? You got to sign up for these new 5G phones. It's just an upgraded 4G. This is not the 5G that is where they have to have a cell tower every 500 feet, folks. Okay. So the telecom industry has really confused people and mixed people up by referring to the latest upgraded 4G as 5G, which makes sense. But they also referred to this new 5G millimeter wave technology, which requires cell towers to be every 500 feet and creating a smart city network as 5G. And we really should call that something else, like this, just the smart city grids, right? Or the, millimeter wave, grids. And that is where those towers need to be every 500 feet or 600 feet, somewhere around there. And they can be as close as 6 feet to outside of your bedroom. And that's where it's the Internet of Things that whole network is, where your cell phone can talk to your refrigerator, can talk to your phone, to your laptop, to your car. And your car can then remind you to buy milk when you're driving past Walmart because it knows that you don't have milk in your refrigerator, right? So that whole smart city Internet of Things network, that's what we've been referring to as 5G. But then Verizon and AT&T and T-Mobile came in and said, oh no, we're going to call our new upgraded 4G 5G and get everybody to sort of accept all of it, at one time. So sorry about that lengthy description, but you've just got to understand the difference between the next generation of 4G is they're calling it 5G, which makes sense, but they've also been referring to the smart city network as 5G. And we've been fighting that tooth and nail so that we don't have cell towers 5 feet or 30 feet outside of our bedrooms. Okay, everybody clear on that? Hope so. Yes. Question? You have a question? No. And can you mute somebody? Thanks so much. Okay, so this campaign, now this is separate. This is this article.
So basically, you'd have to go here, right? And then you turn back and jump
One
to
second. Okay, thanks, Anne. I appreciate it. So this article is called "We Are Not Sam" campaign. Is about this a community group based in Australia. Thank you, Australia. It's an intense lobbying group led by Byron Shar. They have been able to remain 5G free. And this "We Are Not Sam" campaign refers to the dummy that is used and tested. It's called specific anthropomorphic mannequin. So it's a mannequin that it's like rubbery and it's got water in its head. And it's what they use to see whether or not the cell phone heats up the liquid in Sam's head within a certain period of time. So sorry, can you mute somebody else? There's background noise. It's driving me nuts. Thank you. So during the test, which has not changed since the mid-90s, the SAM plastic head is filled with liquid to see if it heats up 1 degree Celsius within a 6-minute call. And now SAM is based on 100 kilogram, 6 foot tall adult military recruit with a 5 kilogram head, which is pretty big. And this is not a kid, right? This is not an 11-year-old. A lot of people are getting their 11-year-old cell phones. And this is not a woman, right? Women have a thinner structure to their skulls that protects their brain. So this is a 6 foot tall military recruit man. And it's about the liquid in the head heating up. It's not about muscle tissue or nervous systems or membrane, anything like. It's about the liquids heating up. And so it's really not an accurate way to test whether or not there is damage happening. And they're saying it's also, the problem is that only 3% of the population fit the profile of SAM. Most people, such as women, children, and elderly, have smaller and thinner skulls than SAM, which means they will absorb substantially more radiation. And essentially, we've become the test dummies for the multi-trillion-dollar telecom industry, with so much to gain from pushing out 5G phones on unsuspecting market. And the safety standard is an absolute joke, which is devastating for health on the planet. So that's how they determine whether or not something is safe. They only look at the heating up of the liquid in the brain of like a 6 foot tall adult military man. And so these tests are not accurate for our children, for women, for elderly. And there's been over 2,000 peer-reviewed research studies which demonstrate harm to human health from wireless radiation. The number that I've heard from Daphne from Children's Health Defense was more like 8,000. So I guess it sort of depends on which studies you're looking at. Some might be for wireless and some for radio frequency radiation. It just sort of depends. Cell towers, there's all kinds of studies. So this article on the Defender is really great. Again, we appreciate the Defender. And here's the article on, here's the page, wearenotsam.com. So if you want to check that out, wearenotsam.com, to boycott 5G phones. You do not have to upgrade if you don't want to. That's from what I hear so far. There may be places where they're saying that you have to. But really the 5G is, the upgraded 4G is simply, it's just upgraded 4G. And right now what we have for 4G in most cases is pretty darn good. You can download a movie pretty quickly. You can make your phone calls, you can text, and you don't need the upgraded 5G. The other smart city grids that we've been talking about and calling 5G for a long time, you definitely do not need, and you do not want to have cell towers 5 or 30 feet outside of your bedroom. You should be finding out in your neighborhood if that type of technology is coming into your town. They're called small cells, and they're antennas and small cell facilities. And you want to ask your city council members if they plan to install any of those. That's for the smart city network. So yes, and Eileen is saying that there's been a 5G moratorium call in France. France has really been smart about a lot of things. They're banning glyphosate in 3 to 5 years, something like that. They require restaurants to give their leftover food to the homeless. I believe they banned plastic bags and straws and things like that. So, I mean, France has it going on. They're doing really good there, good things there. Let's see. Lady Carla Davis, you called somebody. Okay, I'm not sure quite who that is yet.
Excuse me, I called Qantas because this affects me. There are no
Okay.
flights out of Queensland. And of course, I was very upset. And they're very nice there at Special Handling. And she assured me that it wasn't set. And from what I heard, they had a lot of objection from IATA. They were trying to get, Alan Joyce is the CEO, and he was trying to get all the airlines to comply. So of course I wrote a very strong letter and objected, and she told me to put everything in writing. And I feel the more people call Qantas like what you did and said, the better. Let it be known. They need to get huge amount of, and I got a lot of people to write letters too, that they're not going to fly anymore. I mean, people here are outraged. And really, who is going to be liable when people start getting sick?
Right.
Good.
Yeah. Very good point. Thank you, Lady Carla Davis, for speaking.
Believe me, I'm keeping on that 100%.
Okay, great. Yeah, and the fact is that, it's not that we don't want people to, it's not that we want people to spread COVID, right? It's not about that. It's about the potential damage from the vaccine. And we know from the Moderna study that the 100% of the subjects that got the second dose had side effects. Some of them were serious, some of them were more mild. And the meeting that I was on this past week, so I'm going to segue into that a little bit. The CDC ACIP meeting, which is the, what does that stand for? Can somebody tell me what ACIP stands for? I keep forgetting what it.
Advisory Committee on Immunization Practices.
Thank you, Susie. Advisory Committee on Immunization Practices in the United States. People that basically decide the vaccine schedule for 350 million Americans, right? All the top head people. I was on that meeting this past week for 4 hours and listening to the process to hear how they would decide who would be the first ones to get the COVID vaccine when it's approved by the CDC and ACIP. And what they discussed was whether or not it would be the long-term care facility workers and the residents or not. And they never discussed if it would be anybody else. It was only long-term care facility workers and the residents. And then the next level, I believe, would be hospital workers, teachers, policemen, firefighters, EMT workers. And then the next level in phase 1A, B, and then the next level C would be the elderly people over the age of 65. But what they did was they basically took the 60 people in phase 1C and popped them into 1A by including the long-term care facility residents in with the long-term care facility workers. And yes, as some people are saying on Instagram, that the vaccine can make you an asymptomatic carrier. And we know that about other vaccines like the whooping cough vaccine, right? It can make you a carrier. And so there was a discussion about that. It was very interesting to hear because right off the get-go, somebody asked, what is the efficacy of the vaccine? And the CDC staffer said, we do not have data on the efficacy of this vaccine. That's something that we will get in stage 3. So they're talking about who's going to get this on a wide scale without even knowing the efficacy, which to me is very disturbing because that means people in stage 1 and 2 are, they're all in the experiment. So, so people are saying that, like, aren't politicians essential workers? I think they should be first in line. Yes. So they didn't talk about that though. They only talked about long-term care facility workers and the residents being the ones to get the vaccine. And there was one person, Dr. Talbot, who said that she thought that that the residents shouldn't get the vaccine. It should be the workers. And it was because the vaccine had not been tested on that group of that population, the elderly residents. There was another gentleman who said, yeah, I agree, it should be the healthcare workers and not necessarily the residents because the visitors have already been restricted to the residents, right? The only way that a resident is going to get exposed to COVID now is through the workers. So if you vaccinate the workers, theoretically, if the vaccine works, then you would be preventing the exposure to the residents. And I thought that was very reasonable as well, but nobody offered to, to change the wording of the proposal. And so they talked about, how to administer it. They talked about the VAERS report, vaccine adverse event reporting system, although the man who reported on it, Dr. Tom, never said those words. He just said the national, warning system for vaccine safety, which made me kind of bananas because it's not about vaccine safety. It's about vaccine harm. It's about damage. That's a reporting system for when you experience harm. So yeah. And so they had euphemisms for, they called them signals instead of reports. They called them, vaccine adverse event reports. They called them signals. And so that was interesting. And he said it was a very fast system and it would be updated every 1 to 2 weeks. And I have to say that's a bunch of malarkey because I personally know a woman who reported her son's vaccine damage, checked back a couple months later, it wasn't in the system, checked back a year later, it wasn't in the system. So she refiled it. And now it's been 4 years later and she still can't find her case number filed, in the vaccine adverse event reporting system. So relying on this VAERS system for nurses and healthcare workers to report damage that happened in their facility, which they're not highly motivated to do that, right? It's not like a really good idea to report that there's been all kinds of damage happening in your facility, maybe even by your hand. They're not super motivated to do that. But if they were to do that, to depend on this system in order to update the safety, monitor and update the safety of the vaccine is really not going to be reliable because the studies show that only 1% of the people that get vaccine damage actually report it. And in addition, a lot of the people, I don't know, Susie or anybody else that has experienced vaccine damage, I know when I tried to report it, the nurse at my father's rehab facility and at his doctor's office didn't even know what I was talking about.
Well, I was just going to say,
yeah, go ahead.
Sorry,
Caitlin?
Zen, I was going to say that in nursing school, we learned to give vaccines at the Veterans Hospital and it was the flu shot. And so we just line up and that's how you learn to give shots essentially. But I, going through nursing school, had never heard of VAERS, was never taught of VAERS, was never taught of an adverse event reporting system. There was not one. I didn't learn about it until, 5 years after nursing school, going into my own research, but there was nothing in the curriculum, not one thing.
And you're a registered nurse and they didn't teach you about the VAERS reporting system.
Correct. Yeah, none. Never heard of it.
But they don't even teach them in medical school. They only teach them the schedule.
Yeah, they teach the schedule and they don't teach ingredients about vaccines. They just, So our doctors and nurses are not highly educated about this vaccine adverse event reporting system or vaccines themselves. And so that's why we have, such a problem right now with the vaccine reactions and with the problem that just all of this happening in America right now. Sorry, I'm trying to talk and read comments at the same time. Yeah, but nurses are generally the ones that administer the vaccines. You'd think they'd be taught about VAERS. Yeah, you're right, Susie. It's usually not the doctor, right? Usually the doctor says, okay, you're going to get this shot, and that shot. That's the schedule. This is the time. And then the nurse comes in and does it. So you'd think that they would be the ones to be educated, but they're not. So anyway, so this ACIP meeting, they voted, after there were public comments, there were only about 4 or 5 people that were able to comment. One of them was somebody that was a nurse veteran who asked all the questions that you would want to have asked. And she did a great job. What about long-term effects? What about, synergistic effects? What about, the ingredients, all kinds of things. And then there were 4 other people who were spoke on behalf of the long-term care facility workers and the residents getting the vaccine first. And they even tried to push, mandates and prison workers and prison people in prisons and all of that as well. So that was very disturbing. And keep in mind, folks, that again, this population, the long-term care facility residents were not included in the safety trials, right? So it's definitely a gigantic experiment to have them get it, be one of the first ones get it. And so therefore extremely disturbing. Now people have asked, so who would you like to see get it first? Well, I'd like to ask you guys, who do you think should get the COVID vaccine first, considering it's been rushed and it's been shown to be risky? Anybody have any ideas? Gates. Eileen says, yeah, Bill Gates. Yeah, he's been putting billions of dollars, at least millions, I don't know, maybe billions into vaccines. Yeah, perhaps Fauci and perhaps how about the CDC members and the ACIP members themselves? How about they get it first? They're probably consider themselves essential, right? And I would think that the CDC, the FDA, and our politicians, our elected officials, definitely any governor that's going to consider mandating this vaccine should be first in line, I would say, in getting the COVID vaccine. So, yeah, and there are people who are saying whoever wants the vaccine should get it. And I do have to say that in the meeting, that is something that the CDC members said, that this vaccine, when it's available for the people who want it, would be the ones to get it. So now, but that doesn't mean that the long-term care facility or a hospital or a school might say it's required, right? So they could require it for the people who use their private facility, their business or whichever. So yeah, so those, yeah, and definitely all the health officials and politicians who are mandating it should get the vaccine. Yeah, absolutely. So I'm going to see if I can get my plug here for my phone here. Sorry, folks. Okay, and so next, speaking of the side effects, there was a post put out, and I think probably a lot of you saw it. I'm going to screen share it now. Let's see, Green Med Info posted about it as well. So this is a screen, a slide from a presentation that you're looking at right now from an FDA presentation. It says FDA safety surveillance of COVID-19 vaccines, draft working list of possible adverse event outcomes, and it is subject to change. And so these were 21 different side effects from vaccines that are in a list in the presentation, because they have to determine, what are we looking for once the vaccine is administered? They're going to use this, quote unquote, fabulous VAR system. What are we looking for as far as what may be reported as a side effect? We need to track that, right? They need to compile that data and use it to quote unquote, make the vaccine safer, right? So it's just some of these outcomes. I cannot pronounce all these words. So excuse me, I'm not a doctor, but I know Guillain-Barré syndrome, the acute disseminated encephalomyelitis, transverse myelitis. We've heard about that as one of the side effects already from the COVID vaccine trials. Convulsions and seizures, stroke, narcolepsy, and cataplexy, anaphylaxis. That's something that my children have had. Acute myocardial infarction, myocarditis, autoimmune disease. We know that. They even list deaths, pregnancy and birth outcomes, non-anaphylactic allergic reactions, just like rashes and things like that, arthritis and Kawasaki disease. I can't pronounce the other words of these other conditions. Multisystem inflammatory syndrome in children, and vaccine enhanced disease. What the heck is a vaccine enhanced disease, folks? Is that, that's when it's the disease and more of it. Okay, so like basically you're vaccinated for COVID and you get COVID, right, for a couple of days. You actually get that vaccine enhanced disease. Okay, so this is on Green Med Info, and you can see the article put out by them. It reveals 21 serious conditions as possible adverse outcomes. When I posted this slide on Facebook, there was a link to the full presentation, which is, you can see some slides of it down here below. And just within minutes of posting that, all of a sudden the link to that presentation became no longer available to the public. So these are some images from that presentation. I think one of my friends was able to download it very quickly and did get it. But you just want to be aware, this is a big deal. This is a very big deal, because the FDA is actually acknowledging that these symptoms are something that they need to be aware of that could happen from the COVID-19 vaccine, and they are tracking them. So they're actually, you know, acknowledging that.
Zen,
And this is also, yes.
Susie posted the link and I just downloaded it, the whole
Okay,
thing.
great. Okay, so some people have been able to get the link to the entire presentation, but this is the most important slide and the one that you're going to want to share the most. And you know, this is really, it's really disturbing, very disturbing, because these types of side effects have been happening for so long. And the reason why they're tracking these side effects, folks, I want you to know, it's not just because this is what's happened in the vaccine trials, right? I think a few of these have happened in the vaccine trials, but these are the side effects that have happened from other vaccines. And the whole reason why they're able to rush this vaccine in such a fast pace is because they decided in the health industry, that they would base the safety of this vaccine on previous trials, right? On the ingredients and the makeup of the previous vaccines. They're like, okay, so we're gonna basically take the vaccine mixture, you know, the ingredients and the way that it works as a precedence from all the other vaccines. And we're gonna, you know, base all of this information on previous vaccines. So when they do that, they also have to consider all of the side effects from those previous vaccines. And so this is what's possible. I just want to make it clear. These are not the side effects that are going to happen from the COVID vaccine. These are the side effects that could happen because the safety trials are based on other vaccines. But again, extremely concerning, and your loved ones should know about this before they consider getting this vaccine, that they frankly will be a part of a giant experiment. Any other comments, anything I missed about this information? Yes, Eileen, you want to add something?
Yes, I think it was Dr. Zach Bush talked about, we don't only have to worry about the consequences of this generation of receiving vaccines, but the next generation, and in some studies, it's been the third generation in animal studies, they were infertile. So it's not just this generation we're talking about. We're talking about 1 or 2 or 3 generations of us.
Yeah, and it's the same thing with glyphosate and you know, and GMOs. That's what got me started on all of this. I never wanted to be an activist. I was an entrepreneur, and before this, a fashion designer. This was not on my list of things to do. But when I saw the study that, you know, the rats that ate GMOs, or maybe it was gerbils or hamsters, the third generation was completely sterile, I was like, wait a second, I want my grandchildren to be able to have children one day if they want to. I want them to be able to experience the profound love that it is to be able to have one's own child if they wish to. And so it was future generations that really motivated me to get started. And when you start seeing the data, that's not just from GMOs and glyphosate, but also
I'm sorry, what's going on? I'm
also
Moms Across America.
GMOs, glyphosate, and 5G as well has been shown to cause, you know, electromagnetic radiation, right, has been shown to cause, you know, reproductive issues. So this is about future generations, current and future generations, and epigenetics. So hi, Mark, good to see you. I saw you and I remembered I needed to, of course, mention 5G. So I'm going to be, we already talked about the 5G issue. I don't know if you were on now, but and the dummies. So we'll talk about that again later. Maybe you and I are catch up on that. So let's see, what else do we have going on? Okay, so one other issue. Anybody else have anything you want to say about the COVID vaccine and the side effects? Did I miss anything about the ACIP meeting?
Well, I just read an article about a priest in Philadelphia who was in the trial who passed away of a heart attack, but of course that had nothing to do with the trial.
Right.
And you listed myocardial infarction and other heart issues in that FDA document.
Yes, yeah, they don't say heart attack. There's the medical descriptions for them, but that's what that means. Yeah. So Very concerning that have been numerous reports out of South Korea and Brazil and United States of severe, severe side effects and also deaths from the COVID trials. So, we do not want to be fear mongers. We would love for the economy to come back, for everybody to get out there, for there to be some quick fix solution. But we just do not see, based on the historical evidence of vaccines that contain, aluminum and mercury. Some of them still contain mercury. We know a glyphosate weed killer has been found in vaccines, and the sheer number of vaccines, based on the information that we have seen thus far, we are extremely concerned about the safety of this rush vaccine. So please do share that information with people and your loved ones that are considering it. And please do it in a way that does not attack them and make them wrong. Just be gentle and curious if they have seen it, and share it in a very kind and compassionate way. You will go much further in being able to have them actually consider the information if you do not come at them like, you've got to see this and get your head out of the sand and wake up and, like all of that stuff. It just doesn't work to make people wrong. They won't listen to you. They'll just dig their heels in and defend their position. So please do consider, yeah. All right, so there was I think we're good on that topic.
I had a
so
question
now-
about the
Sure.
vaccine enhanced disease, the last bullet on that slide.
Yes.
Is that referring to like the cytokine storm that we're hearing about?
I don't know. What I think that actually means is that you get the disease for a little while and it like flares up. So you get COVID for a little while, right? And
Okay.
It's like 2 or 3 days. Yeah. And they actually referred to that at the ACIP meeting that I went to that I talked about earlier. I don't know if you were on, but they called it reactogenicity. They didn't even call it reactions or side effects. They call it reactogenicity. And reactogenicity, when you look it up on Wikipedia, is expected side effects of vaccines. Like basically you get the flu symptoms for a few days after you get the flu shot. You get a pain on site and you get a high fever and you get, basically the symptoms. And so in the ACIP meeting, they said, yeah, so some people were thinking about going into a long-term care facility and vaccinating everybody, the workers and the residents within 3 days, done deal, quick, and out of there, would not belabor the situation. But then one of the presenters said, actually, due to the reactogenicity, we suggest that you stagger the vaccinations of the healthcare workers. So, and what they pointed out was, one guy said, well, yeah, because that's a good point. If you give all the EMT workers the vaccine on the same day, you might be out of EMT workers the next day, right? They may all come down with those symptoms. Now, what they were talking about with the reactogenicity was just the side effects of that, like the mild symptoms, the getting COVID for 2 or 3 days. They didn't refer to transverse myelitis or encephalitis or heart attacks or anything, right? They didn't refer to that. But they did actually mention, though, in the VAERS reporting system, when he said that there might be a delay of 1 to 2 weeks, that would really only be because of hospital visits, that sometimes it takes that long for them to check out and to process the paperwork. So they are acknowledging hospital visits that could last 1 to 2 weeks, right? So that's, yeah, but but the cytokine storm is I think that's different from the enhanced disease, but I could be wrong. I don't know. I'm not sorry about that.
Do you also know that, the process within long-term care facilities? I have 2 aunts, one that's like 88, another one that's 91, I believe. Like, how can they consent? I just don't understand. Are they just going to kind of line them up in nursing homes? Or I'm trying to understand that process because I'm not a direct, person in charge of their care. I'm like 2 steps removed in the family, but I'm just trying to imagine what is going to happen there.
Okay, so they did address that, and they said that the residents would have to consent or assent, and consent means to agree, right, to it and sign a form saying that they would get the vaccine, have a signed form. And assent means to agree to someone else's decision. So that could be the family member that would assent to the resident's decision to get the vaccine, or the caregiver's assent to give the resident the vaccine. They would have to
What if
assent
they
to
say
that.
no?
What's that?
What if they say no? They're gonna be kicked
They
out?
didn't cover that those rules are up to the facility, right? So the facility, I don't know, they could just say we're only going to have residents that are vaccinated. They could, I don't know if they can make that determination out, if that would be considered discrimination. We're not clear about that yet, but there was expressed concern that, well, what about these residents that aren't lucid, that aren't clear? There could be, that could be problematic. And what I envisioned was all of a sudden two siblings disagreeing about this issue and it like tearing a family apart. This really could be very detrimental to siblings who disagree about this issue.
So Frankie said down here that the fine print upon admission in New Hampshire by either patient or family agrees to the shots. If they refuse, they can be denied a bed. So I guess, Carly, you'd have to look at the fine print on their admission.
Yeah. So
Okay.
many residents already have a document on file that is an assent to vaccines. Yeah. So they can give them whatever they want. So in many ways, these residents could be sitting pin cushions for the pharmaceutical companies. They're just money makers, and I know when my father was in a rehab facility, he left there on 17 medications. 17. They were just big pharma was just using him as a money maker. We moved him into our house, and within 4 months, by the time he moved into our house, this was like 6 months later. And this was 6 months after he got vaccine damage. He got the DTaP and the flu shot. And within 2 months, he had emphysema, COPD, liver, chronic liver disease, kidney disorder, congestive heart failure, and he had to have open heart surgery within 2 months of getting these 2 shots. Before that, he had no internal organ damage at all. He had bad knees and bad ears from World War II and bad eyes. That's it. He just had old folk stuff. He was walking 1.5 miles a day by himself, and he was living by himself. And all of a sudden, within 2 months, open heart surgery, can't live by himself, in a rehab, costing $475 a day for 24/7 care. And he was on 17 medications. Now, a couple months later after rehab, 6 months after this open heart surgery, when he was 91 years old, he went down to 12 medications. And then when he came to live with me on an all organic diet and, all this kind of stuff, he got down to 2.5 medications in 4 months.
Wow.
Yeah. So he did get better. And he had a level of, sorry, I'm just posting this to Instagram. He had a level of 246 parts per billion of aluminum in his body. And the first ingredient in the DTaP is aluminum. And when a year later, after giving him Fiji water every day, which has silica in it, and it helps draw out the aluminum, his levels went down to 6. So,
Really?
And his cognitive ability was restored. Yeah. When we first came to us, he didn't even want to read a magazine. And by 2 weeks before he died, he was reading A Brief History in Time by Stephen Hawkins. And he read A Secret Life of Plants, like really, challenging books. So he was able to, recover his cognitive ability, but his liver and his kidney and his heart were so damaged that the vaccine damage killed him. And I had his records reviewed by a 3rd generation doctor, ER doctor, and she concurred that before that he was fine, and then afterwards that he was, terribly damaged. So, and I have not been able to file the VAERS report because the doctor that administered them shut down. They had some drama that went on there, and all the documents went to some office. And so I only got half of the data, one of the shots, I think it was the DTaP shot. I wasn't able to get the flu shot lot number, so I haven't been able to file. But so I know how difficult it is to file the VAERS report. It's very complicated. So if the patients develop symptoms, Frankie's asking, how would anybody know whether they developed a vaccine reaction versus old age disease? Yeah, that's a very good point. And the other thing is it could be reported either way, right? They could be reported as deaths from COVID side effects, or they could be reported as deaths from old age, and so none of the side effects may get reported in a long-term care facility because they may just report them as, coincidental old age happenings. So, all right, well, that was the vaccine issue, the health freedom issue. And now we move on to the organic fraud. We only have a few minutes to cover this because it's already 9 o'clock our time. Anne, can you share I gotta mark you screen share. Okay, go ahead. You can screen share now the article. So this is just published. We haven't even posted it out there yet. We just got notification from the California Department of Food and Agriculture that the brand AgroGold organic fertilizer has been found to have glyphosate and dicamba in it.
Wow.
Yeah, and it's really disturbing, and we have been wondering this, right, for a long time, because we know that organic food has been found to be contaminated with glyphosate. And we know most organic farmers don't use glyphosate. They're not interested. They're organic for a reason. They're smart people. They don't want to use Roundup or glyphosate. And so it's either the wind and drift or rain or the fertilizer. And most of the farmers that I've talked to suspect that the fertilizer is the biggest culprit. And this is because some of the fertilizers, many of the fertilizers could be from CAFOs, confined animal factory outlets or whatever.
Well, it depends where they're
feeding
it depends on where they're getting their stuff to make the fertilizer.
Right. Yeah.
Sure, if they're organic, they're trying to go organic.
Right. But if they don't know where the fertilizer is coming from, and it's coming from a confined animal feeding operation, or called CAFOs, then those animals are fed GMOs sprayed with glyphosate, and it's getting into their, and or dicamba, and it's getting into their manure. So this is just confirms what we've suspected. And when I was back on the California Organic Products Advisory Committee Board, which was it was an advisory committee that advised the Secretary of State of Agriculture in California, I pushed for glyphosate tests for organic food because we knew it was being contaminated, and we knew that the organic certification was losing trust. A lot of consumers were concerned, is it really organic? And so I made a proposal, I requested repeatedly for there to be testing on organic food and fertilizers. And I pointed out that the fertilizer is probably the source of the contamination. And I received a massive amount of pushback. People on our side said, no, we do not want to risk the farmers' livelihoods. And I said, but the testing is going to be anonymous. No one will know which farmer that produce came from, but we will know, and they will know, and then they will be able to find the source of the contamination and stop it, right? You can't do anything about anything if you don't know what's happening. You have to know what the source of where it's coming from and why it's happening. And they were really not happy with me, and I was really not happy with that. And eventually my time on that board came to a close because I wanted to focus on the Moms Across America Gold Standard, which is, really creating what we want. And so I couldn't be on the board and do the same thing at the same time. It was just their rules about that. So yes, you can stop screen sharing, and that article will be up tomorrow. We hope that you'll share it. And our request is that organic farmers find out what the source is of their fertilizer. If enough organic farmers make requests to the fertilizer sources for non-GMO, organically fed, animals, the manure from those animals, then there'll be more of a demand. Like, it's not going to happen unless we demand it, right? So we need to demand it, and we need for the fertilizer companies to ask those questions and to demand the manure from animals that have not been fed GMOs or grain sprayed with glyphosate. It has to happen. Unfortunately, the baby food testing that was shown last year by the Healthy Babies Bright Future showed that the organic baby food had higher levels of heavy metals than the non-organic baby food. And I'm so sad to point that out. But the reason being is because, according to farmers that I've talked to, that the conventional farmers that, for the squash or the peas or the spinach or whatever that's used in the baby food are able to use straight up chemicals like phosphorus or nitrogen, right? But the organic farmers have to use manure. And so when they use manure from CAFOs or farms that don't use, that may feed their animals GMOs sprayed with glyphosate, then they're introducing heavy metals into the manure, because Roundup contains arsenic and heavy metals. Pesticides are basically made from sludge from petroleum companies. So they take the sludge from, fracking and petroleum companies, and they stick it in pesticides. So it contains all kinds of heavy metals. So very disturbing about the organic, that's basically organic fraud. Whether it's intentional or not is another story. But at this point, fertilizer companies need to be testing for glyphosate and heavy metals, and dicamba is very, very toxic. So anything else about that? Anne, did I miss anything from that article? I think that's it.
No, I just wanted to say that though I did, and I know it's on a smaller scale, but I did see, I think it's a documentary Fresh, which I believe you were in, where they had an organic farmer who was using nothing but plant-based organic compost.
Yes. So we interviewed, oh my goodness, Nigel Palmer. He has a book out about amendments for soil that I think are predominantly plant-based. Like you could take this year's tomatoes plants, put them in a barrel with some molasses, let them ferment, and they will be the perfect fertilizer for next year's tomatoes. Like things like that, or ground up, seashells, or gypsum, or different types of soil amendments. You don't even have to use manure. So that's an important thing to note as well. Thank you, Anne.
Also, I just had one more thing and I have to screen share real quick. But we're going to be coming out with this maybe in the next 2 or 3 years.
What?
Oh, I didn't share it yet.
Anne, jeez. Yeah, so we will pop up wherever. Thank you for doing that in the past 10 minutes, Anne. Yeah, we'll pop up wherever need be.
I couldn't help it, Zen. I couldn't help it.
This is why we've been able to do Moms Across America for so long, because I have people with a sense of humor on my team, particularly Anne. So we're able to get through this. Yes. So, okay. So glyphosate in organic fertilizer, very disturbing, expected. And it's a good thing that the California Department of Food and Agriculture is actually testing. In addition, another reason why it's so important is because glyphosate is now being considered for listing on the Prop 65, the California Prop 65 list, for being an endocrine disruptor. It's already on the list as a carcinogen. However, Monsanto and Bayer have sued to get it off the list as a carcinogen because some people don't agree. And so they want to try to get it off the list as a carcinogen. Of course, we don't want that to happen. So we are supporting the listing of glyphosate on the Prop 65 list as an endocrine disruptor. And this Thursday, I will be speaking on the meeting held by OWIHA. It's called a diptych or something, or daptic meeting. I forgot what the initials stand for, but that's happening on Thursday. If you know anybody that is, a scientist or a doctor or a professor or somebody who's been studying this for a long time and wants to speak or present, they can do that as well. And I can get them the information about that. So that is an important development. And we really do hope that the California Office of Environmental Health Hazard Assessment, OWIHA, lists glyphosate as an endocrine disruptor. Also, because why this is also important is because it's come out that glyphosate herbicides do moderately harm the 93% of endangered species and 97 or either 96 or 97% of their critical habitats. So it has been shown by the EPA, they finally have done their assessment on endangered species, and glyphosate does moderately harm the endangered species and their critical habitats. And they actually admitted that glyphosate is highly toxic to aquatic invertebrates, like fish and snakes, and is toxic, regularly toxic to marine life, and is moderately toxic to mammals. The last time I checked, we're mammals. So it's astonishing to me that especially under this administration, that this information has been able to come out. And I can only say, my only understanding or reasoning for this is because there's so much evidence. There's over 1,000 reports of glyphosate herbicides harming endangered species. 1,000. So I believe that this is going to go forward with some severe restrictions. It should equal a ban. And so we'll be asking people to comment. We have 60 days, so it's until the mid-January. So for sure in January, we'll be asking people to comment a lot. We're starting already, and we've posted the link on our website on momsacrossamerica.org if you want to comment. I'm just going to screen share real quick. These are just some of the studies that I have sent them, and they're listed on our website under reproductive issues for glyphosate herbicides. And here's just some of the studies that show endocrine disruption, disruption of placental cells, or endocrine disruption, harm to testes, female fertility, sperm and eggs, autism-like symptoms, after exposure, maternal exposure, things like that. So there are plenty of studies to refer to. If you would like to make a comment, please do, refer to a study if you care to, or just express your opinion about it. But it is very important to get glyphosate banned, to get it on the California Prop 65 list as an endocrine disruptor, and to also get it banned. All right, any comments about that? If not, we're gonna wrap up pretty soon. Anybody, somebody said, Peter, was it Peter? You said you had something about a wild organic study. Did you want to mention that while you're on with us today? Wild organic food in general, or wild organic study that you're doing. Okay, you have to unmute yourself if you want to mention that. The molasses recipe, by the way. Yeah, so yeah, 1 second, Peter. I just want to answer Eileen. Nigel Palmer is the gentleman that has a book out about soil amendments. And I'm sorry, I don't remember the name of it, but Nigel Palmer. And you'll post it? Okay, thank you so much. And he has the recipes for putting molasses in with your vegetable, your leftover vegetable stuff and compost and all that. Okay, so Peter, you want to mention some sort of study that you're working on?
Yes, it's I spoke to you years ago. I don't know if you remember. I was talking about wild organic food. I'm from Canada.
Okay, no, not right now. Sorry.
It was like 3 or 4 years ago. It was like a long time ago.
Okay.
But I'm a health physicist, and when I was back in school to do a second degree in pharmacy, when I was going to become a doctor in '92, when GMO food was harvested the first time, I ended up in a wheelchair, and no one could figure out why. My father's a doctor, had the best care, and after 10 years, everybody gave up, and all the operations were a success, but he didn't recover. And then what I figured out is that the problem is I'm allergic to all food. And when I eat older variety food, all of my symptoms went away, and my gray hair turned back to brown. And when I actually found this out, I was actually in a wheelchair. I had a really bad reaction. I was almost dead, and all I could move were my fingers. But luckily, I was able to basically sell everything I owned and borrow money on everything I owned. So I had $150,000 in a pile. So I had enough to survive and recover. And I started eating wild organic food, like wild rice. There's a chicken farmer that has older feed that they feed their chickens, and bird-friendly coffee. But what I've been doing since I was disabled, since '92, I was a tutor, and I had a student that had Crohn's, and he was sent home to do palliative care at home, and they gave him 2 weeks to live. And I convinced his mother to change his diet, and he didn't die. And he turned into a normal boy. And that was probably 5 or 6 years ago. And I spoke to him about a year ago, and he's got a job and he's working full time.
Wow, you saved his life by convincing his mom to change his diet. How amazing. That's so great.
But everybody who's done this, they've recovered.
Yeah.
From whatever chronic disease they have. And the problem that I've got is that I'm still recovering from when I was in a wheelchair. So my health is extremely limited, and I have no money left, right? And I'm funding this all myself. So it's the kind of thing, if anybody's interested, then they can help me. My email is on there. But because I'm a health physicist, and I can get seed from any seed bank in the world. And I was invited to sign the Treaty on Preservation of Seed. So I can get any wild seed from anywhere, even the stuff that's not available in nature. But the problem is I'm having difficulty growing it out. So but everybody who's changed their diet, they've all recovered or haven't died.
Wow. Well, I just acquired 6 acres. I might be able to grow some wild seed for you if you need it.
Where are you?
In North Carolina.
Okay, so it's a little far. I'm in Toronto, but the other thing I found is that everything that marijuana treats, wild organic food cures.
Anything that marijuana treats?
Yeah, wild organic food cures.
Cures. Wow, very interesting. Wild organic food. So that's just a whole nother level. That's way beyond organic. It's wild organic. So what you're basically talking about though is an indigenous person's diet. Indigenous people harvested wild, seeds and fruits and rice and plants, and you're talking about an indigenous person's diet. So which would be quite healthy if they're not spraying glyphosate, aerial spraying over that
but
area.
the University of Northern Michigan, their Department of Native Studies, they did a study on the pre-colonial diet on Native Americans, and they found the same thing that I found, feeding it to younger people. But they were using all their traditional foods, but I've got the database of all their plants that they ate. And I actually went through that and I determined which ones had the best taste and which ones had hazards. And I basically went through all of that. But it's wild organic is also anything everything we eat came from some wild plant. Peas, corn, beans, whatever it is, right? So what you do is you get the oldest palatable variety or the wild variety. Like I've got some wild einkorn in the fridge that I need to plant, and I can get wild chickpea or whatever there is. It started off as wild before it was cultivated.
Right. Wow. Well, that's fascinating. I'm so glad that you found a solution. And I'm so glad that you're sharing this information with other people to have them get better. And if we think about it, you're basically eating your ancestral diet, which really makes sense. And I used to go to an iridologist in California, and she said that I'm half Chinese, and she talked about how a lot of her patients were Asian. There's a lot of Koreans and Japanese in Southern California. And she said that what she was seeing, that the elderly patients that were Asian, the grandparents and the parents that would come in, they just had old folks problems, some hearing issue or some eyesight issues or, things like that. But the young population of the Asian, her Asian patients had all kinds of diabetes and inflammation and autoimmune issues, and they were overweight, and they just had chronic health issues. And when she told them to eat the way their grandparents did, those health issues would go away. If they went back to the food the way their grandparents were eating, they would be fine. But if they were eating the Western American fast food, junk, restaurant food, they would get sicker and sicker.
Well, my theory is that what happens is when they breed, what they're doing is they're creating proteins that we're allergic to. Like when you breed two plants, you increase the number of chromosomes in the nucleus.
Yeah.
So when you do that with transcription, you actually create other mutant proteins that don't affect everybody, but affect some people. And what you're creating is an allergic reaction. Because what I find is that after 4 days of switching the diet, people are not puffy anymore. The inflammation goes down. They pee out a bunch of liquid, and then they get better. It takes about 4 to 7 days.
Wow. That's amazing. Thank you for sharing that. That gives us hope, because so many of us think, oh, it's going to be, forever. I have to restrict myself and go on really severe diets forever. But if you think about it in chunks of 4 to 7 days, not that you're going to go back to eating the garbage, right? But that you can get you can get better in that short a period of time. That's really phenomenal. And that coincides with some of the lab testing that I saw as well from Health Research Institute. They would have a guy that would be going on a glyphosate-free diet, eating all organic. And then he'd go to a birthday party and have one slice of pizza, and he did urine testing every day. And then that day would spike up, but the spike would go away within 2 to 3 days. So if you,
my
you can get that out of
CRP
your system. Mhm.
Yeah, anybody with a CRP that's high, it's a blood test.
Mhm.
Anybody with a CRP that's high, a CRP is a measure of inflammation. And my CRP was 80. Now,
Mhm.
2 or 3 is high risk of a heart attack.
Oh my gosh.
My rheumatologist thought I was going to be dead sitting there in his office. He was flipping out. They gave me chemotherapy because they had run out of things to try. And I knew that the problem was somehow my diet got out of whack. And then I figured out what the 2 things are that I was eating that were causing the problem. And my CRP went from 80 to 1 in 2 weeks.
Oh my gosh. Peter, you need to write a book. Like right
Well,
now.
I just messaged him to ask him if he wants to post his link on Facebook, because I just looked him up and there's a lot of Peter Monroes in Toronto.
Well, right now I'm not actually on Facebook. Right.
Oh,
Well, I had 3 people on my Facebook thing, and then I messed up the login. And the problem is that one of the people that friended me then became really famous, and I can't contact them, so I can't get back on.
Okay, so Peter, can you just email me at zen@momsacrossamerica.org and we can communicate afterwards? We gotta wrap this up.
Yep.
But I really appreciate you sharing the information. Email me at zen@momsacrossamerica.org. And for those of you that came on tonight with the last minute notification, I really appreciate it. I'm so sorry I had something happen today and I just didn't post the link earlier, but I appreciate you being on, and I really appreciate the input. And Frankie, you asked a question about the Great Barrier Reef and glyphosate. Yes, they were spraying glyphosate around the Great Barrier Reef. I don't know if it was directly in it, but there was definitely runoff in it, and there's been tests to show that glyphosate was in the Great Barrier Reef. So that's happening all across the country. It's happening down the Gulf of Mexico. There's a lot of glyphosate running off into our oceans, killing the marine life. And yeah, this has been a very valuable conversation. I appreciate your time, and please do, whenever you want to come on and share something like what Peter just shared or anything else. It doesn't have to be that monumental, but I want to hear from you as well, because we really value what you have to say, and it makes a difference in the campaigns that we do and the work that we do. So once again, thank you very much, everybody. Have a great night. Take care.
right.
Bye-bye.